Suzanne. My name is Marine. I'm going to be your therapist today. Tell me what brought you here today.
I'm here today because I've been on Xanax. This is what's been helping me for a long time. And the other therapist wants to discontinue it. Yeah.
Okay, before we go any further, let me disclose a privacy confidentiality statement to you. Whatever we discussed here is confidential. No information will be released to anyone that is not a part of your medical care. Any information that will be released will need your consent and your signature. The only time we will have to release information without your permission if it's at any time you pose a threat to yourself or others. Do you agree with that?
Yes.
Okay. So tell me a little bit about why you're taking the Xanax and how long you've been taking the Xanax.
I've been taking the Xanax for a few years because of high anxiety that I have all the time.
Mm-hmm. And can you tell me a little bit about the anxiety? What are you feeling when you're having the anxiety?
I have different symptoms, all of a sudden I feel scared, and my heart rate goes up, and my breathing goes up as well.
Mm-hmm. Okay. Can you give me a second, Kathy? I have to answer this call. Hang on a second, Kathy. Hi, good morning.
Okay.
So tell me a little bit, I'm sorry about that interruption, Kathy. Tell me a little bit about your history of your anxiety and why you're taking the Xanax.
I've just been taking Xanax for a few years. I'm not exactly sure where the anxiety came from, but I just started having the symptoms like maybe 5 years ago.
Okay. Mm-hmm. Tell me what symptoms are you having when you're anxious, when you're having the anxiety. Tell me, what are you doing and when are the symptoms most noticeable?
Usually at night, before I go to bed, and sometimes I have panic attacks. That's how serious it becomes. So, but usually it can happen anytime, but when it happens at night, it's more serious, more intense.
Mm-hmm. Tell me the symptoms that you're having when you're having the anxiety. You're coughing, or you're trembling, or you're shaking. Tell me a little bit about what you're feeling.
I feel scared, I shake, my heart rate goes up, and my breathing, I start breathing very fast. Sometimes I sweat.
Okay. Tell me a little bit about your family life and your family support.
Yes, I live by myself, and but I have family living in the same area. My parents and sisters and a brother.
Mm-hmm. Oh, any children?
No.
And any history of anxiety or any history of any mental illness in your family?
No.
Any history of drug use in your family or with yourself, apart from the Xanax?
No, none.
No. What kind of work do you do, and what kind of social activity do you partake in?
No, right now I work in the hospital,
mm-hmm.
and as pertaining to the social activities, I have friends. We meet usually every week, most of the weekends, and we get together.
Okay.
Yeah. And
Okay.
also Sunday, I usually go to church.
Mm-hmm. Do you do anything other than go to church? Do you partake in any activity for fun? What do you do for fun?
Oh, normally just meeting with friends and having drinks here and there,
What do
cookouts.
you, I'm sorry, say that again?
Cookouts, you know.
And cookouts, okay.
No.
What do you love to do? What are your hobbies?
I love to travel, although I don't have the money.
Mm-hmm.
That's, my biggest hobby, and just socializing.
Okay. Where have you traveled before?
Oh, so far, I've been to Mexico. That's the only place I've been, but I would like to go to many other places.
Okay.
Yeah.
All right. Can you remember a time without the anxiety?
No, no, not really, because since I've had it for so long, that's all I remember, being anxious all the time.
So once you started taking the Xanax, after you've taken the Xanax, how do you feel?
Oh, in about 15 minutes, I feel very calm and all the symptoms are gone.
Okay. Is there at any point during the day, okay, all the symptoms of so no sweating and no jitteriness, no feeling, no increased heart rate. So I'm hearing that the Xanax takes all these symptoms away, and you've been taking the Xanax so long that you do not know how you feel without it. You've never been without the Xanax for the last 5 years. Is that correct?
Correct.
Okay. So you can't remember how you felt before you started taking the Xanax, is what I'm hearing?
Yeah, I don't exactly remember how I felt, because since I've been taking it for so long, so the only thing I remember is taking Xanax. And when I don't take it, I get really, really bad symptoms.
Tell me a little bit about going in high school. Were you taking the Xanax during high school?
No.
No.
Yeah, I just started about 5 years ago.
Okay. So were you taking the Xanax when you started your job?
Yes.
Yes. Okay. Were you taking the Xanax when you graduated?
From school?
From high school, yes.
I graduated about 20 years ago, so I was not taking Xanax then.
You were not taking Xanax then.
Yeah.
So let's roll back to about, what did you do between this current job that you started 5 years ago and high school? It's 20 years.
Oh, I've been in and out of different jobs here and there.
Mm-hmm.
Yeah.
Tell me about the job before this job. Were you taking Xanax before you started that job?
Yes.
Mm-hmm. You were taking Xanax while you were on that job also?
Yeah, I was, yeah. Because this new job, I've been on it I'd say maybe 2 years. So
2
prior
years.
to that, yeah.
Okay. How long were you with your previous job?
About 10 years.
About 10 years. And when you started that job, you were not on Xanax, because you were taking Xanax about 5 years ago, correct?
Correct.
Okay. So tell me, when your job before this, you went for your interview. Tell me how you prepared for that job.
It was pretty easy. I didn't need to prepare because it's a cleaning job, so there was really no preparation.
Application, the interview, getting there that morning.
I did an application.
The interview.
Yeah, I did an application. I went to the interview, where they asked me to clean 2 rooms, and they were very happy how it came out. So they gave me the job.
Okay.
Yeah.
How did you prepare? Were you experiencing cleaning rooms? Tell me how you went about cleaning the rooms.
Usually, patients' rooms are normally very dirty. So sometimes there's blood on the floor, sometimes there's urine on the floor. So it can be really, scary experience at first.
Mm-hmm.
But later on, I got used to it.
Wow. So how did you come over that fear? What made you think at that moment when you were doing that job that you could do it? Because then you were having the anxiety, but you did. Tell me what made you figure you could do this job.
Yeah, I just knew that the Xanax will help me continue with this job. And
no, when you started the new job, the one 10 years ago,
mm-hmm.
and you were learning how to clean a room, tell me how you did that job, how you planned that job, performed so you could get that job. How did you feel when you were doing that to get that job?
I felt a little nervous, although I had cleaned other places. I cleaned people's houses and stuff, but going to the hospital was like really, kind of scary for me. Yeah.
But you did it.
Yes, I did.
You did.
Yeah.
Tell me a little bit about how you made yourself do that. You recall that?
Yeah, the money was good and there was benefit. So I told myself I have to do it.
Oh, okay.
Yeah.
So you had something in you that said, what would you call that? What would you call that? I must do it. I had to do it. What is that?
It was
if
just
you had to name that I must do it that you just mentioned, what would you call it?
A drive.
You had a drive within you.
Yes.
Where is that drive now?
Somewhere hidden inside me.
Okay. All right. Not a problem. The drive is still there. I'm going to give you a scenario, Kathy. You go to bed tonight. You go to bed. I give you a magic pill that I have over here. And I'm going to ask you to take the magic pill. What the magic pill does is when you wake up in the morning, all the symptoms of your anxiety and needing the Xanax causes you to need the Xanax. It's going to be gone. You wake up and anxiety is gone. You felt the way you felt 10 years ago. You had the drive. Tell me how you would feel if when you get up, anxiety was gone. How would you feel? The magic pill took it away and now it's gone. It's way out there somewhere looking for somebody else.
I would be extremely happy.
Mm-hmm. Tell me a little bit more about the feeling.
Mm-hmm. I would be extremely happy if that happened.
How would your body feel? What would be going on inside of you?
I would feel like I had actually conquered my problem, one of my biggest problem, not having anxiety despite not taking the Xanax. So that would make me very happy.
Any other feelings would come to mind that would make you feel that would, without the Xanax and anxiety is gone, any other feelings come to mind, something that you would do with your life? Tell me a little bit about that experience. Dream a little.
Yes, I would be more brave to get into other things or, because right now I always feel like I can't do anything because, especially without the Xanax, because I'm scared of getting into anything new or whatever, so if that feeling went away, then I'm sure I would be able to do a lot for myself in my life.
Okay. So I'm hearing that if the anxiety went away tomorrow morning, you'd be able to do a lot, not specific. Mm-hmm. And You'll be able, I'm sorry, I didn't get part of it. You'll be able to do a lot. You'll be happy. And what else?
Yeah, I'd be more brave and willing to go and do, things that right now I would be scared of doing.
Okay.
Like looking for more challenging profession or stuff like that.
Okay. All right. So I'm hearing now that you're a little scared. You're afraid of the challenges of life and to do new things. Is that correct?
Yes.
Okay. I'm gonna wrap up the session, but I have an assignment I'd like to give you. In respect to being fearful and having a drive, I'm gonna ask you to do an assignment for me. It's gonna be a little challenging. It may even be a little different and out of your realm of what you normally do. I'd like you to, when you go to church this weekend, or when you go to church on Sunday, I'd like you to participate in a social group and attempt to lead the group. I'd like you to make suggestions in the group. This is a very challenging situation, seeing that you are afraid of new things and you afraid of going out there, you have no drive. So I'm sure you're familiar with church, you go to church. Mm-hmm. Tell me an activity that is done at church, outside of church, or something that is even done at church, during church, that you think you could do if you were challenged.
Done in church? Or I would like to, participate in, at my church, there's always groups that go to different countries to volunteer for a week or 2 weeks.
Let's start with something small, something, just a little something you'll do in one day that you accomplish in probably 1 hour, something small.
Or passing out greeting cards. I would, like standing at the door and giving people cards.
Okay.
Yeah.
Sounds good. Now, if you can only do that for 5 minutes, that's a start. I want you to make the necessary arrangements. I figure you have to call one of the elders and say, I'd like to volunteer today to pass cards out. Mm-hmm. And I want you to plan the whole thing. And if you can just pass out cards for 10 minutes because of your anxiety, let me know. I'd like you also to keep a diary of when you feel most anxious. Your Xanax will be tapered, so I'm assuming that some of that anxiety, which may be a drive, will come back. So once you start feeling that anxiety, the jitteriness, that heartache, all the symptoms that go with the anxiety, I'd like you to keep a little diary for me. How does that sound?
It sounds very good.
Okay. So your assignment this week is you're going to pass greeting cards out at church for even 5 minutes. That is fine. And you're also going to keep a diary for me also. Mm-hmm. How does that sound?
Sounds very good.
Okay. Now, in terms of your Xanax, we're going to taper the Xanax like I mentioned, but we're also going to come back here with a session on 2 days from today. Mm-hmm. If at any time during that time the anxiety gets to the point where you feel like you're going to hurt yourself or anyone, please pick up the phone and call the 1-800 number I will give you, or call the office and ask to speak with someone. There's someone there 24 during office hours to speak with you. There's a therapist. Okay?
Okay.
But outside of that, I'd like you to work on the assignment, and I'd like you to keep a log of what you're feeling or what you're going through for the next 2 days.
Okay.
Can we work on that?
Yes.
Okay. Sounds very good, Kathy. So I'll see you in 2 days.
Thank you.
All right. You have a good day now. Thank you.
You too.